Maxillary central incisor. Welcome back to another video of our dental anatomy series. In our previous videos, we discussed dental terminology, laying the foundation for our journey through the intricate structures of the teeth. With these concepts in place, let us learn the anatomy of each tooth in detail, beginning with the maxillary central incisor. Nestled elegantly on either side of the midline within the maxilla, the mesial surface of each tooth is in contact with the mesial surface of the other. These teeth are distinguished by their incisal ridges or edges, in contrast to the cusps present on canines and posterior teeth. Let's begin with its chronology. By 3 to 4 months of age, the initial signs of calcification of the maxillary central incisor become apparent, while enamel attains its full formation between 4 to 5 years. The teeth erupt by the age of 7 to 8 years, completing the final stages of root development by 10 years. Before diving into its crown, root, and pulp morphology, let's have a quick recap.
Pop quiz.
Now let's see what is the difference between an incisal edge and an incisal ridge. The incisal ridge constitutes the complete incisal portion of the crown. In newly erupted incisors, this portion is rounded and merges with the mesio-incisal and disto-incisal line angles, as well as the labial and lingual surfaces. Unlike the term ridge, edge denotes an angle arising from the convergence of two flat surfaces. But remember, an incisal edge isn't initially present on an incisor until the effects of occlusal wear create a flattened incisal surface, forming an angle with the labial and the lingual surfaces. So two incisal edges are formed by the junction of incisal surface with the labial surface and the lingual surface, creating the labio-incisal edge and linguo-incisal edge. Now let's start with the crown morphology of maxillary central incisor. The crown of a tooth displays remarkable features from the labial, lingual, mesial, distal, and incisal aspects. Before we proceed, let us understand how to describe a tooth. When we see the tooth from the labial aspect, we see the mesial and distal outlines as well as the labial surface. So to describe it, we need to trace the path of the outlines and explain the surface, including the curves, elevations, and depressions visible. Coming back to the crown of the tooth, let us discuss each aspect in terms of dimensions, outlines, the crest of the curvature cervical line, and the surface. Let's begin with the labial aspect. If you focus on the outline, what you see is the incisal, mesial, distal, and cervical outlines. Let's start from the mesial end of the cervical line. The line is relatively straight till the incisal third, and the maximum crest mesially is seen at the mesio-incisal line angle. From here, the outline is almost straight till the disto-incisal line angle. This surface may, however, show 3 bumps in the outline, which represent the mamelons formed by the 3 lobes labially. The maximum curvature on the distal side is more cervical than the mesial crest of curvature, but remains in the incisal third of the tooth. After the crest of curvature, it follows a nearly straight outline till the distal end of the cervical line. Labially, the cervical line is rounded and semicircular. Key points to remember from the outline are: the mesio-incisal angle is sharper, while the disto-incisal angle is rounded. This helps us identify the mesial side of a tooth and thereby identify the side of the tooth. Both the mesial and distal crests of curvature are in the incisal third itself. The distal is more cervical than the mesial. Keeping this in mind, on observing the crown, we will be able to calculate two dimensions. One from the highest point on the cervical line to the lowest point on the incisal edge, or the cervico-incisal dimension, which is about 10 to 11 mm. The next one from the mesial crest of curvature to the distal crest of curvature, or mesiodistal dimension, which is about 8 to 9 mm. While describing the labial aspect, we must not forget the labial surface. If you feel the labial surface of the tooth, it shows a prominence on its cervical portion. This represents the labial crest of curvature, the outline of which will be better seen from the mesial or distal aspect. From the cervical prominence to the incisal edge, there is a flat surface. However, on this flat surface, two developmental grooves may be noted as developmental depressions, which make the three lobes visible.
Pop quiz.
Let's get back. We have learned the labial aspect in detail. Next, let's view the tooth from the lingual aspect. Can you name a few elevations and depressions seen on the lingual aspect of the anterior teeth that were covered in our last video? Well, the lingual surface is not as smooth as the labial surface. While the outline of the labial surface is like going around a small hillock, the lingual surface is like going around a lake. The outlines are the mirror image of the labial aspect. The lingual aspect is represented by a small hill at the cervical area and three mountain ranges in the mesial, distal, and the incisal area. This configuration gives rise to a smooth depression in the middle called the lingual fossa. The hillock represents a smooth convexity or elevation seen right below the cervical line called the cingulum, which is formed by the fourth lobe. The shallow concavity or depression, that is the lingual fossa, is bordered cervically by the cingulum. The mesial and distal marginal ridges on the mesial and distal sides and towards the incisal area, there is a presence of a slightly raised incisal ridge. Thus, the lingual topography gives a scoop-like or shovel-like form to the crown. Also remember, there can be a presence of developmental grooves extending from the cingulum to the root, called the palato-radicular groove.
Pop quiz.
Let us now rotate the tooth so that the mesial aspect faces us. Trace the outline of the tooth from the most labial part of the cervical line. We see that the labial outline shows a convexity which is maximum in the middle of the cervical third. After this small curve, called the labial crest of curvature. The line goes relatively straight till the incisal ridge. It is important to note that the incisal ridge is in the midline and is aligned with that of the root apex, or maybe slightly labially placed, but never lingually placed. After the curved outline of the incisal ridge, the tooth outline follows a concave or convex path lingually. The concavity from the incisal ridge extends till the junction of the cervical and middle third and represents the lingual fossa, and the convexity represents the cingulum. The maximum crest of curvature of the cingulum is seen at the middle of the cervical third. Unlike the semicircular cervical line seen in the labial aspect, it curves incisally. These features give the crown a triangular or wedge shape, with the base of the triangle at the cervix and the apex of the triangle at the incisal ridge. The distal aspect is the mirror image of the mesial aspect and follows similar outlines labially and lingually. The most prominent difference noted is that the extent of the cervical curvature is more on the mesial side than on the distal side, towards the incisal ridge. This feature helps in differentiating the mesial and distal surfaces of the tooth. The tooth is rotated along the arch, tilting it distally, thus making the distal aspect look bulky, giving it an illusion of greater thickness. It's worth noting that most teeth are naturally tilted slightly on their root bases to accommodate the curve of the dental arch.
Pop quiz.
Lastly, let us discuss the incisal aspect. On viewing the tooth from this aspect, we are unable to see the root portion as the crown superimposes over the root entirely. Can you identify the surfaces or landmarks of the crown portion? Let us first understand which portions of the tooth represent the incisal outline. When we look at the tooth from the incisal aspect, the mesial and the distalmost outlines will be represented by the mesial and distal crests of curvature, which are located at the mesio-incisal and disto-incisal line angles respectively. The labial and the lingual outlines are represented by the crests of curvatures present in the cervical third, both labially and lingually. In between this outline, bisecting in the middle, is the incisal ridge. The labial surface appears broader than the lingual surface, and it has a convex outline. The most prominent feature seen from the incisal aspect is the lingual outline. It appears to taper towards the cingulum, making it triangular. Let us look at the tooth from the lingual aspect. The mesial and distal surfaces of the crown, as well as the root, are visible from the lingual aspect, because both surfaces slant toward it. This concept is called lingual convergence. Having covered the crown morphology, let's now shift our focus to the root morphology. The root is generally 2 to 3 mm longer than the crown. The root morphology can be described from labial, lingual, mesial, and distal aspects. Viewed from the labial aspect, the root of the central incisor typically has a cone-shaped structure, often with a relatively blunt tip. The mesial and distal outlines are regular, whereas when viewed from the lingual aspect, it shows considerable variations. The lingual portion of the root is narrower than the labial portion. Let us relate it to the concept of lingual convergence. In order to understand it better, let us take a cross-section of the root. It takes up a triangular shape with rounded corners. The sides of the triangle indicate labial, mesial, and distal surfaces. The mesial and distal surfaces taper and point lingually. So the crown and root taper toward the lingual side, resulting in the crown being wider at the labial line angles compared to the lingual line angles. Now choose the correct option from below with respect to the cross section of the root. The correct option is B. So the mesial side of the triangle is slightly longer than the distal side, which means the root appears slightly broader from the mesial aspect than the distal aspect. Lastly, let us also discuss the pulp morphology of the maxillary central incisor in brief. Dental pulp is the innermost soft tissue structure in the center of a tooth. It is divided into a pulp chamber and a root canal. Its morphology varies from one tooth to another. The pulp chamber of a maxillary central incisor is located in the center of the crown and is mesiodistally broad. In young patients, there may be the presence of 3 projections or pulp horns corresponding to the mamelons on the incisal edge. It usually has one root with one straight root canal that is ovoid or round in cross section. I trust that you now have a comprehensive understanding of the maxillary central incisor. Before we conclude, let's also examine this clinical picture. Direct your attention to the incisal third of the tooth. Do you notice any variations in color when compared to the rest of the tooth? It's akin to looking at a frosted glass window, and this visual effect is referred to as incisal translucency, a phenomenon that arises from light interactions with tooth enamel and dentin layers. Enamel is the outer, more translucent layer, while dentin beneath it is less translucent. This combination creates the characteristic semi-translucent appearance at the incisal edge of teeth. Note that the degree of incisal translucency can vary from one person to another, and this knowledge is crucial for dentists to achieve aesthetically pleasing dental restorations. Numerous methods have been utilized to attain the desired incisal translucency in composite restorations and porcelain veneers. That was a lot of information. Let's end this video with quick takeaway points. The crown of the maxillary central incisor is broader mesiodistally than labiolingually. The crown and the root taper lingually, making the lingual portion of the root narrower than the labial portion. The mesio-incisal angle is sharp as compared to the disto-incisal angle. The mesial and distal crest of curvatures are at the incisal third of the crown. The labial and lingual crest of curvatures are at the cervical third. The lingual fossa is surrounded by 4 elevations from all sides. The curvature of the cervical line is the greatest on the mesial aspect.